The LBG medical prescription form is designed to gather as much information as possible to help the lab manufacture the orthoses which you have prescribed for your patient. Please remember that the size of your patient's foot and the quality of your cast may affect the finished device. For more information about this, please contact our evaluation team on the details below. Practitioner Details. Firstly, we need information about you and your practice details. Please fill in clearly your name, address where you would like your orthoses sent, your email address and telephone number. It is also useful to indicate with a star which your preferred method of communication is in case we need to contact you about a prescription. Next, select which turnaround service you would like. Our standard is 10 working days and this can be followed on the tracking app. If you would like a quicker turnaround time, tick 5 working days or 2 working days, but bear in mind there is an additional charge for this rush service. Next, we ask that you indicate what type of order you would like. Select whether this is a first prescription, a protection insurance claim, a repeat from a previous order, or a guarantee if your devices are still within their warranty. Next, fill in your account number. If you don't know what this is, give our customer care team a call. Patient details. It's always important to have as much information about your patient as possible. Please fill in their name, state whether they are male or female, and then their age and weight. These details are important for the lab to know because we may make recommendations based on this information. For example, if you prescribed a low-density device for a heavy patient. Please also fill in their shoe size, and if shoe space is an issue, include a template of the inside of the shoe or send in the shoe for which your orthoses will be fitted. Finally, let us know whether you require a pair or just a left or right orthotic. Device type. Type of device you select and the material is crucial to your prescription. We have a wide range of combinations available and these are listed in our catalogue from page 17. We have 2 manufacturing processes here at LBG Medical, traditional vacuum formed and direct milled with CAD/CAM technology. There are pros and cons for using both these manufacturing methods and more information can be found about this on the LBG Medical website. You have the option on the form to select EVA, polypropylene or carbon fibre vacuum formed orthoses, or EVA, polypropylene or polyethylene direct milled orthoses. If you have selected an EVA device, please remember to indicate whether you want low, medium or high density. If you have selected a vacuum formed carbon fibre or direct milled polypropylene or polyethylene device, please specify whether you require the material to be flexible, semi-rigid or rigid. Alternatively, you can select one of the many device types from the catalogue and write it in the box marked Other. Next, you need to specify whether you want your orthoses to be covered to the metatarsals, sulcus or full length. Cast specification. This section gives the lab specific instructions about the shape of your orthotic shell. The arch profile refers to the amount of plaster we add to the arch of the positive cast to lower the arch of the orthotic. Our standard is 3 mm, which means the arch of the orthotic will be lowered by 3 mm. This is standard practice and tends to be tolerated best by patients. If you would prefer a higher arch device, tick No addition, and we will not lower the arch. If you would like a flatter arch, tick 6 mm, and we will reduce the arch of your orthotic by 6 mm. Lateral expansion follows a similar process. Our lab standard is to widen the heel seat by 3 mm to allow for weight-bearing tissue spread. If you would like a narrow device, tick No addition, and if you would like a wider device, tick 6 mm. The MOSI, or medial oblique shell inclination, is a specific prescription variable designed to increase the supinatory moments to a medially deviated subtalar joint axis. We offer this inclination in 3 grades: 25 degrees, 30 degrees and 35 degrees. For more information about the MOSI, please contact our evaluation team. Rearfoot-Posting. In this section, we ask you to specify the degree of correction you require in the rearfoot-posting. Please also specify whether you would like this to be added medially or laterally, and if you want it extrinsically or intrinsically. If you require a heel raise, add the number of millimetres raise you would like in the marked box. If you would like to add a Kirby skive, mark the number of millimetres which you require in the box. Clinicians usually opt for 2 millimetres, 4 millimetres, 6 millimetres or 8 millimetres depending on the severity of the skive they require. Remember to fill in the details for both the left and the right foot. Forefoot posting. In this section we ask you to specify whether you would like any posting in the forefoot. If so, how much in degrees, medial or lateral, and extrinsic or intrinsic. We take our forefoot posting to the distal edge of the orthotic shell. However, this can be extended to the sulcus along with a sulcus length or full length cover if you wish. An FHL or functional hallux limitus modification is a modification which we offer for patients who have a functional hallux limitus. Unless you specify otherwise, we will add a 3 mm medium density EVA sulcus length pad to the base of your orthotic with a kinetic wedge cut out. Shell specification. In this section you can make further modifications to your prescription. A high medial or lateral phalange will increase the height of your orthotic on the medial or lateral side respectively. The height of these depends on your patient's foot size and anything which you may already have requested on the prescription form. Bear in mind that adding a medial or lateral flange will increase the width of your orthotic. Our standard pitch is 4 mm, and this is to accommodate an average shoe with a heel height of approximately 1 cm or half an inch. If your patient's shoes have no heel, consider 0 pitch, and if they have a higher heel, consider increasing your pitch. This will prevent your orthotic from rocking back and forth in the shoe. Our standard heel cup heights range from 10 mm to 22 mm, depending on whether it's a vacuum formed or direct mill device. However, it's best to specify here in millimetres exactly what you want. We recommend a higher heel cup height if you have prescribed a Kirby skive to help control the rear foot better. If you would like a first metatarsal or first ray cutout, tick the appropriate boxes. If footwear is an issue, we have a few options to combat this. Cut orthoses narrow means that we'll make the whole device slimmer. For more information on cut measurements, see page 8 of the catalogue. We can also reduce bulk, reducing the depth of the device and increasing the bevel angle under the medial arch. We can further reduce bulk if you tick ultra low. Here we reduce the depth further along with the heel cup height and underbevel the arch on the lateral side of the device even more. Please be aware that the more of the orthotic we remove, the less control it will offer, so this is a trade-off. Additions. We have listed and pictured the most popular padding additions which are requested so that you can simply tick the appropriate box. We use 3 mm PPT as standard for all padding, but if you would prefer a different material such as Poron, please ask for it in the additional instructions box. There is also an image of the plantar aspect of the left and right feet should you wish to mark exactly how you would like your padding to be cut. Should you require more information of products, we have listed our most popular on the right hand side. Simply tick if you would like more of the following: information on our Protect insurance scheme, a casting chart for your wall, more prescription forms, a pack of postage boxes, or a single postage box. There are a few prescription variables which contradict each other, and we have listed these on the back of the form. For example, if a first ray cutout is requested with a medial phalange, the cutout will cut away the phalange. Please use the large box on the back of the form to give us further information about your prescription, or list any changes you want if you are returning a pair of orthoses. Also include marked templates of your patient's feet if you need to pinpoint specific lesions. Remember, the more information you can give us about your patient and their footwear, the more precise we can be in the manufacturing process. Remember that the lab is here to follow your instructions. For any queries, please contact our evaluation team who would be very happy to help.